I got another great question about how do you determine if a person is a good candidate for a mini tummy tuck versus a full tummy tuck? Okay, so first of all, the name mini does not refer to the length of the incision. I think that's something that patients think a lot, and it's not the case. It refers to whether or not you are doing a full correction of abdominal issues like loose abdominal muscle or lax abdominal wall, whether or not you are making that incision around the belly button to sort of rejuvenate the appearance of a belly button that might be like seriously hooded over with skin. And with a mini tummy tuck, you're really just addressing the skin at that lower abdominal piece, like just above the pubic area and kind of where your C-section incision lives, if you've had one of those. And the main reason why I offer one versus the other is just what issues are we trying to address? If my patient's got strong muscles, good belly button position, no concerns about skin above the belly button, and it's really just low abdominal skin and stretch marks maybe, I think that, and if their belly button also is kind of on the high side, I think that's a good candidate for a mini tuck. And that again just involves, in my case, liposuction to sculpt out the waist, and then an incision that still runs from hip to hip, just like with a full tummy tuck, but we're not doing that muscle repair, and we're not changing the position of the belly button. There's no incisions around the belly button. For patients who have those issues, like I said, loose skin above the belly button, or when they, when we do an exam and we notice that there is a rectus diastasis or a space between their six-pack muscles, which happens with pregnancy and weight gain and weight loss and all that. If that space is big enough that it makes it hard for them to kind of suck it in and they can't really ever look flat, just with muscle strength, basically, then that's a person who probably should have a full tummy tuck. And then with a full tummy tuck, we're addressing skin above the belly button where the belly button stays where it is. I don't cut belly buttons off. They stay where they are, but we remove the skin around it, and that's why it looks like the belly button has moved, and it's magic. But it's not one size fits all. I would definitely, if you're interested in a tummy tuck, make sure to ask, if you're a candidate for one versus the other. And the other thing is take your surgeon's advice on it. If they recommend a full tummy tuck, don't try to twist their arm into doing a mini just because you heard that it's less invasive. What you want at the end is just a good result. And if that means that you have to have the abdominal muscle plication, you'll be glad you did it, because that's part of what really makes a full tummy tuck, like that snap, that flat, that's what gives it that appearance. So if you need it, get it. You won't regret it. Ha, I just made a rhyme. Okay.